So the way I'm looking at this is if we take a three-legged stool and the stool is the vaccine program, if one of those legs fails, then the whole program fails. And so here's an example of each stool. One leg is the actual number of vaccine doses. The other leg is the distribution, equitable distribution. And the third is the prioritization of individuals who should get the vaccine. So right off the bat, we have a shortage of the vaccine. So that leg is not really sturdy. The distribution is not sturdy either because of the rural areas getting to the elderly, and the prioritization also is not sturdy because we've just had a change in the age from 75 to 65. So it's a revolving door, so to speak. So this three-legged stool is not sturdy at all. There's a lot of those legs that are just not sturdy enough to hold this vaccine program up.
What would be your recommendation about some simple fixes?
Well, unfortunately, the simple fix is getting more doses. And I don't, to be honest, I don't know how to do that other than to keep asking the government for more doses, which the state is doing. They're limited; their hands are tied by what's available to them.
I imagine this presents challenges for people like yourself in the field of medicine who know that you need to provide a service to people, you need to treat them, but there is not enough of a resource. So, what should people consider? I mean, there's growing frustration about the very ethics of all this.
The ethical quagmire of this whole aspect of the vaccine program is looking at the prioritization, who really should get the vaccines first, the argument as to who's more worthy than others, and this age issue. So, from the ethical perspective, one needs to keep in mind that I'll paraphrase from Dr. Zeus: a person is a person no matter what. And so everyone is worthy, regardless of whether you're a healthcare worker, whether you're an elderly, whether you have disabilities, et cetera. And so everyone has to kind of be treated equally. The healthcare workers, of course, are put at the top primarily because they're the ones who are going to engage in the treatment. So that doesn't make them more worthy, that makes them more important, so to speak. I'm not sure how to address that other than to say that we have to be really honest, humble with the equity process across the board. Consider, for example, the rural areas. Um, they're not getting as many vaccine doses as they need. What's happening with the Native Americans out there as well. So it is an issue. And how do you prioritize? That's a big issue.
As the virus evolves, as this new variant comes to be here, of course, in the state of Arizona, should the strategy of response be different? Are leaders, medical professionals having those conversations?
So I'm going to be fairly candid. The medical professionals are extremely concerned, myself included, with another surge with the variants that are coming to play. That there doesn't seem to be a sense of urgency outside the medical field that this is going to happen. We are concerned, and so even though we see the current numbers of COVID cases going down, the hospitalizations still are way at the top. If we begin to see a surge of the variants, we're going to find ourselves in trouble again. There are many medical professionals, societies, et cetera, that are sharing that with those who need to listen, and hoping that there'll be some adjustments. But I'm not sure it's going to happen.
So, for the public who are watching this and they think, I can't necessarily count on the state or federal government, what do I need to do in the meantime, given that this global pandemic continues?
Well, and unfortunately, we what we have is what we have. The unfortunate part is everyone needs to keep trying to get on the registration site and getting an appointment, hoping that within the next few weeks we'll get more doses and that the program will roll out to doctors' offices and pharmacies. What I will tell you is what we're seeing, not as much now as we were before, was jumping in line, is having individuals um, suggest that they fit the criteria when they don't. Now, there's no one can fault them for that. I mean, that's where they're really looking out for themselves and their loved ones, and that's what's happening. Is that morally or ethically wrong? Yeah, in the global sense, it is. But when you look at it individually, maybe not so much. However, that's not happening very much anymore, and I think people are realizing that there has to be a sense of understanding and a moral foundation that we need to get those who fit the criteria vaccinated. Where we're hoping to go is that that prioritization system will open up. Give us more doses, and it'll happen.
All right. Dr. David Beta from the U of A College of Medicine, thank you.
My pleasure. Thank you.